Our guest on This is America and the World is addiction psychiatrist and neuroscientist Dr. Judson Brewer. Dr. Judd, as he's known, is Associate Professor of Psychiatry at Brown University, Executive Medical Director of ShareCare, a personalized wellness company, and author of the New York Times bestseller, Unwinding Anxiety. New science shows how to break the cycles of worry and fear to heal your mind. Dr. Judson Brewer, good to be with you this afternoon. Thank you so much for joining us.
Thanks for having me.
I'm going to hold up the cover of your book, Unwinding Anxiety, and I don't know who came up with the graphic, whether it was you or your wife or someone at the publishing house, but when you look at that graphic and look at that brain, what do you see?
A big tangle.
What goes on in the big tangle? Is that the way our minds are really working?
Well, it's the way our minds can work if they trip themselves up. You know, our brains are not really set up from a survival standpoint to get tangled, but when in certain circumstances, we can certainly tangle ourselves up quite a bit.
You focused the book on anxiety, and personally, you know a little bit about that subject, huh?
I do. I've had it in college. I used to get panic attacks in residency training. I've had a little bit of experience, yes.
You're both a psychiatrist, which is MD, and also a neuroscientist. When I use the word neuroscience, what does that mean to us lay people?
Basically studying the brain, studying the nervous system.
Okay, and what do we know about the brain? What have you discovered in the lab, and what fascinates you about how the brain works or doesn't work?
Well, I have to say, we know very little about what there probably is, to know about the brain right now. Neuroscience is a pretty young field. One thing that really fascinates me, and this also relates to my clinical, practice and helping my patients, my psychiatric patients, is really just understanding how the brain and how the mind works. And here, there's some pieces that have been known for a long time, actually, that drive a lot of the behaviors that we do, from smoking cigarettes to overeating to even anxiety.
Mm-hmm. When we're talking about habits, and we're talking about, and we're going to get into this in great depth, but does the brain itself kind of have chemicals going on in it? Can you help me understand that a little bit? So if we do something that makes us feel good or makes us feel bad, what's going on up there?
Yeah, so lots happening at the same time. On the basic level, we've got neurons that are firing, and those neurons fire through, where they release chemicals into synapses, which then go and activate other neurons that are postsynaptic, that are ones next to them, basically. And that really underlies everything from feeling to thinking, and even helping us regulate the basic functions that our body has, like breathing and keeping our temperature at a certain level.
Is it like a big computer system up there?
I think a computer is analogous. It's one of the analogies that we use these days, where it's got a bunch of code that it follows, basically. But I think there are some places where a computer analogy really isn't apt, just because of the beauty and the complexity of the brain itself.
So some of what's going on in the brain is just regulating how we navigate physically through the day, but also what we want to talk about more importantly is what's going on in the brain that affects the body and gets into this whole area of anxiety. One question before we go there. When you talk about the work in your lab, separate that from seeing patients on a day-to-day basis in, regular therapy, huh? So what's going on in the lab, your lab?
Well, in the lab, we take scientific questions that we want to study, and we try to figure out how we can study them in a way that helps us answer a scientific question or a hypothesis. And actually, a lot of the lab experiments that I do are based on things that I've noticed in my clinic. So, for example, if I've got patients who are struggling, for example, with smoking, I can develop a digital therapeutic and app-based mindfulness training program and then test to see how well it works in the lab, where I can do randomized control trials and see if, group A does better than group B, with the treatment versus another treatment. And I can also do neuroimaging studies where I can, as we have people go through a program, like a digital therapeutic program, we can look at their brains before and after to see if their brains have changed in how they fire. For example, we just did a study where people that wanted to quit smoking came into the lab, and we showed them, as we were scanning their brains, we showed them pictures of people smoking, which activated certain parts of their brains that get activated when we get caught up in craving. We could then randomize them to get, this craving to quit app that helps them pay attention and bring awareness into their cravings, versus the National Cancer Institute's app. They have an app for smoking cessation. We could then bring them in a month later and see if there were differences in how their brains reacted to smoking cues. And in fact, we found big differences in, how people that got mindfulness trainings brains activated relative to people that got the control app.
So we got science, and now we add to that therapy, talk therapy. And I like to say that at different points in my life, I did more therapy than Freud. And now we have technology playing a role in helping people get well, huh?
Yes, we do. So for example, in my clinic, over the last year, I've been doing virtual sessions with patients where we'll meet virtually, which is a very safe environment. Mm-hmm. So that's one way that technology can help, is with the face-to-face, but also, I'm in the School of Public Health, where we're looking at health on a population level. And what I want to be able to do is deliver evidence-based treatment to people at scale. So to anybody that has a smartphone. So this is where we've been developing programs for smoking, for overeating, and even for anxiety.
We're going to take a little break right now, talking with Dr. Judson Brewer. Dr. Judd is, you recognize that name perhaps. Unwinding Anxiety is the new book. New science shows how to break the cycles of worry and fear to heal your mind. It's a terrific book. I've had a chance to read it. I said to the doctor right before we started the program, I started to use some of his thinking overnight, as a matter of fact. We'll talk about that on the other side. This has been the year of maybe a pandemic of anxiety, and that's where we're going next. This is America and the World. Underwriting for This is America and the World is made possible by the Japan-America Society of Washington, D.C., the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotendaro Family Trust, the Republic of Uzbekistan, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy. Doctor, put these in order for me, if you would. And this is my own, this is not from the book, this is just the way I was thinking. Stress, worry, anxiety. Which comes first? Where do they descend in order, if they do?
I would put stress probably stress first, where stress tends to be triggered by something in particular. So for example, if we have a long to-do list and we look at our to-do list and we start to get stressed about all the things we need to do, that's where stress can come in. And often stress is alleviated when we start checking those things off. This is different than anxiety in the sense, certainly a to-do list can cause anxiety, but often anxiety just comes out of the blue. I have a lot of patients with generalized anxiety disorder where they just wake up in the morning and they say, I just wake up and I'm anxious, and there's nothing in particular that triggered it. So the anxiety can just be, just be this feeling. And often the feelings of stress and the feelings of anxiety have a lot of overlap, so they can feel similar. But anxiety doesn't have to be triggered by anything. Now, where does this fit with worry? So worry, if you look at the definition of anxiety, it includes the word worry. I think it's this feeling of worry or nervousness or unease about an imminent event or something with an uncertain outcome. So worry can be part of the feeling of anxiety. Yet interestingly, worry can also be a behavior itself. When I'm anxious, I worry. Oh, why am I anxious?
So is it a chicken or egg thing? Which comes first? That's what I'm trying to understand. Because I kind of think, and help me if I'm wrong here, worry is in the mind, where anxiety seems to be in the body.
I think that is true. That's often the case. So that physical sensation of anxiety often triggers worry.
Oh.
Yet the worry can feed back and trigger more anxiety.
So they're in tandem somewhat.
Often,
and is
yes.
the worry this idea of not being able to know the outcome of something? Is that why do people worry? I guess that's the question. Why do they worry?
Yeah, it's a great question. So this is actually based on some of our survival mechanisms, whereas when our brain, the part of our brain called the prefrontal cortex, it helps us survive through thinking and planning, yet it needs accurate information to do that. And so when it doesn't have information, our brain urges us to go get information. We kind of have that itch to go find something. Analogous to when we're hungry, our stomach rumbles, and then we go get food. When we don't have information, our brain rumbles. so we go try to get that information. The problem is when we can't get that information, when that when that itch can't be scratched, we're scratching and it just doesn't satisfy it. Yeah. That's when we start to trip into the realm of anxiety itself. We start to get anxious when we can't solve a problem, when we can't figure something out, or when we feel out of control.
Let's define a couple of other things. The difference between a habit and an addiction. And you may know that I'm a recovering alcoholic, so that is in the addiction camp. But how about the difference between a habit, maybe a good habit and a bad habit, and an addiction?
So our brains actually help us set up habits as a way to be efficient and survive. So imagine if we had to relearn everything from tying our shoes to walking to even talking every day, we'd be exhausted by breakfast, right? So, so learning habits, I think of this as it helps us set and forget. We set a habit and we forget about the details so that it frees our brain space up so we can learn other things. So that's a habit. Most habits are good habits, right? Tying our shoes, good habit. Being able to have our fork or spoon hit our mouth without us having to pay attention, good habit, right? So if you think of bad habits, these are habits that we've perpetuated that might have been, served some function or given us some reward in the past, but might not be helpful now. So for example, smoking. People tend to start smoking at the age of around 13, very young, teenage years. And they would get this reward of, whether it was being cool at school or, rebelling against their parents or whatever. There was something rewarding about smoking, yet that's never a good habit, right? So they develop the habit of smoking, or there could be a simple, biting somebody's nails where, biting your nails really isn't going to help you survive, but it's a habit that gets developed sometime in life. So this is where, bad habits, they're not going to necessarily, biting our nails isn't going to kill us. It's not going to reduce our lifespan. But if you look at an addiction, and I learned this simple definition of addiction in residency, which is continued use despite adverse consequences. So this is where, it's not just alcohol and cigarettes and opioids and whatever. It's anything that really leads to adverse consequences. So, this is where, a habit, let's use alcohol as an example. So somebody could be in the habit of having a glass of wine, to unwind at night while they're cooking dinner or something, or have a beer, have a beer with friends, whatever. That obviously, if the drinking leads to adverse consequences, that's when it falls into the realm of addiction.
So yeah, my thing is you use over a period of time, you abuse, and then you kind of cross some kind of imaginary line, and it's all downhill from there. So do you subscribe to the fact, as we've stumbled into the addiction area, which fascinates me, of course, and I thought quitting cigarettes was harder than quitting alcohol.
Yeah, for most people it is.
Why is that so?
Well, so let's say you smoked a pack a day. That was 20 times a day that you were reinforcing that habit, that habit loop.
Yeah.
Whereas, it's hard to function. You can function while smoking, but it's hard to function while drinking excessively all the time.
Yeah. So in saying that you can. So I want to go back to, why is it harder to quit the smoking than the drinking? Is it because you're not getting into disastrous circumstances at the time that you're smoking?
So that's part of it. So with, often we've heard this term rock bottom, somebody hits rock bottom and they quit drinking. The rock bottom, smoking is more of a slow burn, so to speak, than hitting rock bottom soon. So people will smoke 30, 40 years and then get cancer or realize they've got emphysema or something like that. And then even then, sometimes it can be really challenging to quit. There are a couple of other aspects around smoking that make it really hard. One is the lungs are a really good way of delivering drugs to our body. And so if you think of nicotine as a drug, you can really get high levels of nicotine in your bloodstream really fast. And that leads to high dopamine spikes in our brain, which is very addictive. Mm-hmm. The other piece to that is related to the, being able to function. We can reinforce that habit loop 20, 30, 40 times a day and do that over, years. I remember I had a patient who had been smoking 40 years.
Yeah.
And we calculated the number of times he had reinforced it. Are you ready? 293,000 times that he had reinforced this habit loop.
Uh-huh. You're using the phrase habit loop. So it's just the continued going back to the same trigger, behavior, reward. That's your phraseology.
Yes, it's my habit to call it a habit loop.
Habit loop. Okay. So the tying of the shoes is just needing to put on your shoes. But how about picking up the cigarette? How does that? What's going on in the body and in the brain that causes someone to reach for the cigarette?
With the cigarettes, so if you think of, let's say that somebody gets stressed out, so there's that trigger. They smoke a cigarette, there's the behavior, and then the reward is that they feel a little bit better, or they distract themselves from whatever it was that stressed them out in the first place. That feeds back to train their brain to say, hey, next time you're stressed out, you should smoke a cigarette. So what's going on in the brain there is our brain's basically learning this process of smoking as a way to avoid stressful situations or get a smoke breaker to cope with stress, just as an example.
Are there like 4 or 5 different habits that you have identified in your psychiatric work and in your lab work in the area of neuroscience that come up over and over and over again? I guess we've talked about smoking and drinking. A couple of others?
Well, I would say I've seen a lot of people develop the excessive use of social media, for example, is a big one. So going on social media is a big habit that people have. Another one is checking the news. So now that we have our phones or our weapons of mass distraction, we can be constantly checking the news, not only to distract ourselves from other things, but also as a way to stay informed. Remember, our brains want information. Mm-hmm, mm-hmm. And the phones are interesting in one way with regard to the news. If you think of, if we check the news, right? We check the news, there's no new news. We check it again. And, in some random interval, there's going to be some new news story that pops up. and our brain says, oh, new news. Well, that's really similar to going to the casino and pulling on the slot machine and pulling on the slot machine and pulling on the slot machine and occasionally winning where we don't know when we're going to win. Mm-hmm. So checking the news in particular functions very much like gambling. At least that's the way our brain interprets it, because it doesn't know when it's going to get that hit, that dopamine hit of, oh, here's something new.
So checking the news, that can be a bad habit, could also be an addiction, huh?
Absolutely.
Okay, so here's the question, and we're only 100 days in or less than 100 days in. Is there a difference between people checking the news under President Trump, not to get political, as opposed to under President Biden?
Yes, I think one thing that kind of differentiates Trump from other presidents is that he was much less predictable in terms of what he would say or do in a particular day. Okay. So diplomats tend to be boring in a good way.
Yeah.
Right? Because we know that people start to get freaked out when they don't know what their political leaders are going to do. Now, this could be good or bad. So some, Trump supporters love that Trump's unpredictable. For other people, it makes them really anxious because they don't know what he's going to do next. It doesn't, it's the same thing, but for some people it excites them. They can't wait for Trump's next tweet. This is another thing that was unique about Trump. He really used Twitter quite a bit. Whereas I don't know if Biden even has a Twitter account because he just, he doesn't use it the way that Trump did. So, the way that people use technology as a way to disseminate information. This was another thing that Trump did where he would announce big things via Twitter. So people started to get glued to checking their Twitter feeds. Oh, what's he going to say next? So just different. And again, that's not a judgment call. He knew how to get people's attention through these mechanisms.
So we've got checking the news, use of social media, drinking, smoking. I guess we'd throw in there eating.
Yeah, stress eating is a big one where somebody's stressed out and they eat. They can temporarily numb themselves. I'll throw another one in there, and we can talk more about this later if you'd like. Worrying can be a habit unto itself.
A habit so worry can be a habit. Yes. How about anxiety? Can that be a habit as well? I guess so, yeah?
The two are intertwined. So anxiety can trigger worry, which then feeds back and drives more anxiety. So as a behavior, I would say, like you described earlier, anxiety is more of a physical feeling.
Yeah.
So I think of it as a trigger that triggers the mental behavior of worrying. So I would say worry is the habit loop itself, or, in the same realm of worry, things triggered by anxiety or procrastination, for example. There's another habit loop.
In our second half hour, I want to talk about the idea of breaking the habit, that, going there. But before, just to leave folks who might have to catch up with us at some other time, can the reward of a habit be negative?
Absolutely. So if you look at worry in particular, when somebody checks to see, what is worry getting me?
Yeah. Not
much. It actually just makes them more anxious.
But if that be the case, why wouldn't they stop?
Yes, that's the $1 million question. That's probably a $1 billion question if you're a drug company, because that's the crux of it. So our brains think there's this thing called negative reinforcement. So meaning that we'll do a behavior to make something more negative than it is go away. Mm-hmm. So there's research back in the 1980s showing that people worry, their worry tends to fall into two categories. One is it makes them feel like they're in control because at least they're doing something. Now, I want to emphasize makes them feel like they're in control because it doesn't necessarily give somebody control. And in fact, worry makes it harder for us to think and plan. So I would suggest that worrying makes us less in control because we're more likely to do things that aren't helpful for us. The other piece is that it just distracts us from the worst feeling of anxiety or fear or something else.
Woo. We're going to have a second program with Dr. Judson Brewer. Unwinding Anxiety is the title of the book. I've read it. It's just packed with wonderful information. We'll pick it up on the next edition of This is America and the World. Thank you, Dr. Judd. If you are in crisis or know someone who is, these resources offer immediate help. For information about This is America and the World, visit our website, thisisamerica.net, or our YouTube channel, This is America TV, and follow us on Facebook and Twitter. Underwriting for This is America and the World is made possible by the Japan-America Society of Washington, D.C., the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotendaro Family Trust, the Republic of Uzbekistan, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy.